My name is Kathy Murphy. I'm 52 and I came to Ottawa in 2013. And coming to the Ottawa Heart Institute, I was diagnosed with a 95% blockage in my left main coronary artery.
My name is Donna Marquette. I am 48 years old and I live in a little town called Mountain. I was diagnosed with type 2 diabetes in January of 2014.
My name is Jean Latarte. I'm 62 years old and I live in Lanark, Highland Township. It started about 5-6 years ago, and because I had problem breathing. I didn't know what the problem was. So when I came to the Lanark Health Center, that's when I learned that I had COPD. It's a pulmonary disease that I have, and I'll have to live with it really.
In our region, over half of the people who live in Champlain have a chronic condition, and about a quarter of the people have 2 or more of those conditions, so it's very significant.
There is no question that in terms of investment in programs of rehabilitation for chronic disease management, to enhance chronic disease management, have profound payoffs for the health system, to say nothing of the immense benefits that they provide to individual patients, clients, and the community in general.
For people who have chronic disease, our key goal is to make sure that people are able to manage those conditions so that they have access to a full range of services that helps them do that. That's one of our key result areas that we've been working on.
Here at the Winchester Hospital Diabetes Education Program, we're very small and very rural, so we see all aspects of diabetes. We have a preventing diabetes program where people might have an existing pre-diabetes diagnosis or they're high risk and they want to prevent developing diabetes. We see people with type 2 diabetes, a new diagnosis, and we see people with type 2 diabetes starting insulin.
The programs that I participate in the diabetic education program helped me learn what I could eat, how I could monitor my blood sugar, how to calculate carbohydrates and fiber and the amount of carbohydrates that I should be eating per day. It taught me the benefits of exercise and how exercise and eating properly will impact the management that I am responsible for in my own health.
By providing the service out in the community, teaching clients more about their disease process, and having a service available here so if they run into trouble, they have someone to call. That, therefore, will then help decrease emerge visits because these clients will know what to do. They won't have to go to emerge because they're unsure of what's going on, how sick they are. They can simply pick up a phone and call us here or come into the center and see us, and they have a resource available.
But I think it's really important that there's such kind of program here, because if the program wasn't here, really, I wouldn't know what the problem was with me. So this helped me cope with it and realize what really the problem is. They explained to me what's happening with my lung. So I say they won't fix it, but I can control it. Maybe my life expectancy would be a little more because I can control it.
Well, I think one of the distinct features of our programming is that a variety of healthcare professionals and other professionals are involved in delivering very specific services that are very relevant to the specific needs of our patients and clients.
Coming to cardiac rehab, I was met by a diverse group of professionals, from physiotherapists to people who were specialized in nutrition, to mental health counselors, the whole basically holistic group of people who were there for me to ask questions, to learn from as I move through this illness, and empowering myself to kind of take back my own wellness.
Since completing the 2-day program and since being diagnosed with this, I have since lost 40 pounds. I am managing my blood sugar on a regular basis. I exercise, so I'm in the best health that I possibly could be in.
The cardiac rehab program provided space for me to deal with what is oftentimes fear and anxiety associated with having a cardiac incident.
My personal goal is to get better, to doing things I like to do before I got my problem with my lung. I think I feel better now than I felt a couple of years ago. So if the program helped me get more active on it, it's a good thing for me. So
So I think out in the rural community, there's sometimes a lack of resources because we're not located in the big city of Ottawa. So the Champlain LHIN has identified that having community-based services local for clients is really important.
We will continue to focus on this area, whether that means doing things a little bit differently, growing some of the programs that are already out there, and continuing to better understand the needs of people with chronic conditions.